Nigeria has reported yet another death to the Ebola virus. This time it is one of the nurses who attended to the Liberian Patrick Sawyer who died of the disease at a private clinic in Lagos. The nurse had been in quarantine at the Lagos Mainland Hospital. She died earlier today. The Lagos State Health Commissioner Jide Idris, who was at the hospital, declined to confirm the death. The death of the nurse brings to 4 the number of persons who have died of the virus in Nigeria, including the Liberian Sawyer, who actually brought the virus to the country. Meanwhile, Minister of Health Onyebuchi Chukwu says another doctor who treated the late Sawyer has tested positive to the Ebola virus disease. All of these latest developments are coming just a day after the health minister gave this update of the Ebola virus in Nigeria.
The first Nigerian to have died from Ebola virus disease, a nurse who attended to the index case, and the third one is a protocol officer working with the ECOWAS Commission that was detailed to go and welcome the index case and other delegates who were coming for an ECOWAS meeting that was to be held in Calabar. So those are 3. So 2 Nigerians, 1 Liberian American are dead. 7 are alive, many of them making progress. Then in terms of surveillance, presently in Lagos, 177 persons who are both primary and secondary contacts are under surveillance. Now, with the end of the 21-day maximum incubation period, those who are primary contacts who have not developed the disease will no longer continue to be on surveillance. In Enugu, we have 21 secondary contacts who are on surveillance. All of them are secondary contacts because the contact they had was with a primary contact, one of those who participated in the treatment of the index case. That person is actually part of the 10 cases confirmed of Ebola virus disease in Nigeria, and that person is receiving treatment in the treatment center in Lagos. But all those contacts that are now secondary contacts in Enugu have been placed under surveillance. I can happily tell you that cases that were not Ebola virus disease clinically, but because now everybody is trying to be careful. In Abuja, we had 2 cases reported by 2 different hospitals. Both of them are negative for Ebola virus disease. In Anambra, the case that was thought, a corpse that was brought from one of those 3 main countries, Liberia, and people were afraid, having come from Liberia, could it be Ebola virus disease? We've evaluated all the primary contacts, all the mortuary attendants, morticians, family members. They were all tested for Ebola virus disease. They are all negative. In Abia, one of the papers carried over the weekend, we have thoroughly investigated. Clinically, what that patient has is called Steven Johnson syndrome. It's a drug reaction to an anti-malaria she took when she had malaria. But nonetheless, we've taken blood, and hopefully tomorrow or next, the result of the blood test will come up. But clinically, we're satisfied it is not Ebola virus disease. In the case of Imo, a corpse that was brought from Liberia, again, the state authorities notified us, and when we started the investigation, we found actually they had a proper medical certificate of death issued properly by the hospital. That person did not die from Ebola virus disease. So we are satisfied and okayed it for normal burial. We also discussed the issue of corpses and how to take care of them. First, we have prohibited now the repatriation of corpses from outside the country. However, just like anything that could be imported, you could ask for waiver. And the waiver has to be granted by the Federal Ministry of Health after due diligence. So far, we've granted 2 waivers for a Nigerian that died in Kenya. The cause of death, very clear, and we have confirmed from the Kenyan authorities, the cause of death was complications from diabetes mellitus. We've also given waiver for a Nigerian that died in India for the corpse to be brought back. Again, we have carried out due diligence. That patient died from cancer of the rectum, and it's not from Ebola, so we've cleared them. You know that interstate transportation of corpses is also prohibited. Again, if you think your relative's corpse must be taken across to your hometown for burial, you must first obtain a waiver from the Federal Ministry of Health before crossing the borders of another state to transport corpse.